Indian healthcare today is at a crossroads. We've accomplished a lot in terms of different health indicators, but there's some fundamental issues that we still have to address as a country. We are facing, as we are facing the dual burden of both communicable diseases as well as non-communicable diseases. And India is fairly unique as a country in terms of having that dual disease burden. Some of the key recommendations that we are making are one, that we significantly need to up the investment and the priority that we give to healthcare as a society, as a country, and as a government. So from the government side, I think some of the very critical recommendations are going to be around giving priority to healthcare, and that is going to manifest itself into providing universal access of some form to about 60% of the population. So there is a budget part of it, and we've estimated that the spend on healthcare will have to move to about 5 to 6% of GDP by 2025, and of that, the government share will be about 2.5 to 3% of GDP. Out-of-pocket expense really has to come down from the levels that is at today to about no more than 30%. From the private sector, I think everybody needs to work jointly together to really improve access, cost, and quality. I think those are the three elements that we need to work towards. So, for example, less than 1% of hospitals today are accredited, and we know the data shows very clearly that when accreditation happens, you get better quality clinical outcomes. So that's going to be one of the recommendations, for example, in terms of within the delivery sector, how do we actually move towards higher accreditation and really set in place a roadmap for measuring, monitoring, and then increasing transparency to clinical outcomes. On the funding side, I think there are three major points that we are making. One is to say that you have to increase the absolute quantum of funds. That's one. Second, you make a very excellent point, which is about better utilization of existing funds and infrastructure. Absolutely needs to happen. I think out of about, on an average, I think we have 1.3 beds per person. But out of that, 0.4 beds per person are really non-functional. And that speaks to your point that, we have capacity, we have infrastructure, but that's not being used. Absolutely, that's going to be the second element which needs to improve. And the third element is in terms of how do we optimize whatever funds we are putting in. And that was going back to my point around the significant out-of-pocket spend that we have, that needs to be consolidated, channelized, and used more effectively than it is done today. I'd like to correct you. It's not the US model. In fact, we'll have a big discussion on health systems later on the day today. The healthcare spend as a percentage of GDP, that's just a metric. You can use that for the US, you can use that also for UK, even though it has a very different system. It's just a metric in terms of measuring funding. So by no means, I think, are we ready for going for the US model? And the US model has proved that there are many challenges with the US model in terms of just the significantly high cost burden that it imposes. I think we will have to go for a mixed model. And, I don't want to steal the thunder for the white paper, but, we are, one of the points, as I said earlier, was that, the government will have to find funds where it can provide through social insurance or programs like RSBY, which are scaled up, etc., where it can provide insurance or assurance to roughly 60% of the bottom deciles of the population, and that will cover some basic primary care and primary, secondary, and tertiary care. That needs to happen, which is very different from the US model, which is really all private insurance funds. Private insurance will absolutely grow. We estimate that private insurance will grow to about 25% of the total. So about 25% of the population today has some form of private insurance. We think that penetration will certainly increase. And in terms of overall spend, they'll certainly, their share will increase, but you'll always continue to need a lot more of socially funded insurance. That is why you need the government to step in the role of a payer, and not only the role of a provider. Today, the government is playing both of those two roles. It's playing the role of a provider, and it's also in some senses through programs like Arogyashri, etc., are playing the role of a provider, playing the role of a payer. I think the biggest challenge from a disease perspective is the dual burden that India faces. So one is, from pure disease perspective, that's the one challenge. I think there's a number of other challenges. You pointed out to infrastructure as one of them, and utilization of the infrastructure. There's another element, I think, which is going to be talent. And even if we put all of the infrastructure in place, our estimates suggest that we are roughly 2 million short in terms of doctors, 4 million short in terms of nurses. And frankly, if you look at the capacity, the medical education capacity that's there, we'll probably have a shortage till for another 10, 15 years.